Hello, everyone. My name is Tim Guest, and I'm the president of the Canadian Nurses Association. We're really pleased that you've joined us today as we talk about CNA's federal election platform, Charting a Course for a Healthier Nation. I want to start by acknowledging that we're speaking to you from across Turtle Island, the ancestral and unceded territory of many Indigenous communities. CNA is the national and global voice of Canadian nursing, and we're putting forward 4 recommendations to the federal political parties during this campaign. Nurses have seen firsthand the cracks in our health system that have been exacerbated by the pandemic. We are also concerned about the impacts that COVID-19 has had, particularly on vulnerable people and healthcare capacity. Sylvain?
Et n'oubliez pas que nous avons 440 000 infirmières et infirmiers au Canada qui jouent un rôle essentiel et accomplissent un travail remarquable dans les milieux précaires à travers le pays, tout en travaillant sans relâche pour que les Canadiens et les Canadiennes demeurent en sécurité et reçoivent des soins de qualité durant la pandémie. N'oubliez pas que les effets de la pandémie n'ont pas été ressentis de manière égale à l'échelle du pays, comme le plus grand nombre d'aînés et de communautés minoritaires et racialisées qui ont été les plus touchés par cette crise. Et c'est pourquoi il est important que les partis politiques doivent s'engager à soutenir les travailleurs de la santé, élargir l'accès aux soins virtuels pour tous, répondre aux besoins des aînés du Canada et bien entendu, lutter contre le racisme et la discrimination envers les personnes des communautés minoritaires. Tim?
Mike, maybe why don't you tell us a little bit about the recommendations?
Thanks, Tim. I'm happy to. These recommendations arose from consultations with nurses and others across the country. And of course, we're not tone deaf. We're in the middle of a pandemic, and some of them arose quite organically because of COVID. But we have to be honest that many of these predated COVID-19, as you know well, and really what the pandemic did was laid some of them bare, so that it really revealed some of the cracks in the system that we have both an opportunity and a duty to fix. COVID-19 has not been an equal opportunity virus, and we saw some of that play out quite worryingly across the country. So to address some of these issues, we have recommendations in 4 areas. First, to support health workers and the health workforce. The pandemic has had a really significant toll on the mental health of nurses and other health professionals, and many of them reporting worsening mental health, anxiety, depression, and so on. And furthermore, the data is very unclear. It's hard to find them, hard to know who they are. We know now that 95,000 of them got COVID-19 during this time, but we're really short on really good health data infrastructure, so we made recommendations in that area. We speak about virtual care, and the acceleration of virtual care during the pandemic was a real silver lining, and now we know, more than 9 in 10 Canadians are satisfied using it, and 3/4 want to continue having it as an option in their care going forward. So we speak to that. The whole issue of aging Canadians, we're heading very rapidly, Tim, and because I'm always teasing about my own age, we're heading rapidly to a time when 1/4 of the population will be over 65, and we really don't have a coherent plan around how we're going to manage that over the next 20 years in terms of costs and where people will live. So we talk about that. And finally, we speak, I think, aggressively and importantly around racism and discrimination, important determinants of health and contributing to poor health and social outcomes in many people. We know that 78% of Canadians support new funding of training for healthcare workers in this area, and more than 4 in 5 say they want us to have a discrimination-free healthcare system. That's the laudable goal on the part of Canadians, and CNA is doing its own hard work in this area and wants governments to work with us on that too. Does that help, Tim?
Mike, I really am pleased with where we've ended up with these recommendations, and I think they really resonate with the conversations that I've had and the communication that I've had from nurses across the country throughout the pandemic. And I think these recommendations will really, they will feel heard, and that it'll give them something tangible to be able to take to their candidates to speak about. And so I'm really happy with them.
Thanks, Tim. And certainly nurses and others spoke to us very clearly about this. So I think we reflected that input. Sylvain, did you have anything to add before we close?
Bien, en lien avec ce qui vient d'être dit, ça démontre justement l'importance de travailler sur la planification des ressources humaines dans le domaine de la santé et bien entendu parce qu'on veut s'assurer que les personnes reçoivent des soins et des services de qualité et sécuritaires là, à travers le pays. Merci.
Thanks, Sylvain. You know, there are 440,000 of us, and we have an opportunity to have an impact during this election campaign. And we would encourage nurses to download the platform, take it when you have conversations with the candidates, and most importantly, go out and vote.